sometimes, unfortunately, a woman may undergo a biopsy and the biopsy may be normal, or unfortunately, a hysterectomy is done without a biopsy. And in retrospect, we find out after the hysterectomy was done that there was a cancer. Sometimes that happens. We see patients yearly that are sent to us because a hysterectomy was done, and on the biopsies of the hysterectomy, they find out that there was a cancer. If that is the case, if the cancer cells are very organized, well organized underneath a microscope, called well differentiated, if the cancer cells have grown into the uterine wall less than half of its thickness, or if the cancer is less than about an inch in diameter inside the uterine cavity, then the risk of spread to lymph nodes is about 1%. So sometimes those women who, in retrospect, we find out, unfortunately, the hysterectomy was done, no lymph node dissection was done, we find out, oops, there's a cancer. Do those women always need to undergo a lymph node dissection when they're sent to a GYN oncologist? No. In those who have well-organized tumors that are not very deeply invasive into the uterine wall, that are smaller than an inch, then the risk of lymph node metastases or spread is about 1%. So 99% chance that that woman is not going to have spread to lymph nodes. Now, in all other cases, if the cancer cells are not well organized, if the cancer in the uterine wall is large, over an inch in size, or if there is deeper invasion into the uterine wall or spread to other areas in the female organs, then certainly the risk for lymph node metastases is higher and lymph node dissection should be done.